K East War Room. This is the BMC War Room. I would like to show the picture of inside the war room. This is the K East War Room of the BMC. This is the same room where they get the details of the COVID-19 patients. These are the phones which has been attended by the BMC staff. All other BMC staff, including the officers, the doctors, the officers who attend the calls and work continuously day and night for the people and make them understand not to panic. From the war room, which consists of three cities, as we know, that is the Andheri East, Vileparle East, Jogeshwari East. These are the three cities which has been covered by this ward, and the office, the BMC of the people here working day and night. As we can see, this is for the 24 hours, and they allot the hospital and the doctors here are been working. Let's talk to the medical officer of health, Dr. Urmila Patil. She will give us the information. Ma'am, you tell us, once you get a call from a COVID patient, or as we know that the government of Maharashtra has clearly stated that the report will come to the ward officer, to the BMC war room, as we can see, and we are standing here. So how do you deal with the patients when you come to know that the patient is positive?
Yes, ma'am, what happens is we receive daily COVID positive patients list in our war room in the morning. On an average, about 400 to 450 patients are there on daily basis. And the report is made available to war room first and then to patients. And accordingly, all the patients are attended through war room. Our staff is reputed here. Teachers are there, doctors are there, along with data entry operators, and we do calls to each and every patients regarding their to tell the status of their report. And after that, according to the symptoms and signs, our doctors ask, our teachers are trained, they also ask what are their symptoms, are they asymptomatic or symptomatic, or any comorbidities are there. These are questions, one checklist is there, questions are asked to them, and accordingly, as per their status of the answers we get, we allot them the bed. Suppose
Okay, my second question was about the same. How do you segregate a patient? Because once, if people, as we know that the demand for the oxygen bed and the ICU bed are very high. So how do you segregate to them, to the people, to send it to the particular hospital, as the allocation of the hospital is also given to the BMC office?
yes, when our team asks whether you have any symptom or not, if the patient is young patient, don't have any symptom, patient is fine, he is living in 2 BHK hall and using the separate toilets, then we allow him home isolation. But if the patient is old age, having comorbidities, any breathing difficulty, we ask. If he is telling that yes, we have any breathing difficulties, then we categorize him as he may require the oxygen, and we allot the oxygen bed to such patients. And some patients, they are they only complain ki we are having much breathing difficulty, and according to age and baki ka criteria, we give them ICU bed. And once the patient is allotted any CC2 facility or any jumbo care facility, their doctors over there, they decide what to do with that patient, whether really ICU is required or not. And,
Uh,
and
the most important, we would like to show you the dashboard. This is the BMC bed tracker dashboard. I would like to show the visuals. In total in Mumbai, as we can see, 160 hospital. All 160 hospital we can see, and total beds. The total beds it's of BKC. As we can see, the hospital we can see is of a the BKC jumbo facility, and in all, as we can see, the total beds, if you can see, it's a 2,328 beds. With this, 747 beds are available for now. If we talk about the suspect COVID patients with O2 bed attached, zero are available. This is the major concern, as we can see. And for the positive, if you can see, the person with a COVID positive, the total bed with the O2 attached was 868. But as we can see, the zero availability, which is a major concern, as we can see, talking about the the BKC jumbo facility. Again, talking about the ICU, which is the most importantly, and we can see the people are literally asking for the ICU bed with the related to the health. But now we can see that it is 67 beds were available in the BKC jumbo center, but now the zero availability is in the BKC Jumbo Center. Doctor, if you can inform us about the overall Mumbai and specifically K East ward. As we know that the Andheri, Jogeshwari and Vile Parle East are this area which comes under the K East ward. So how many beds have been available now at this point of time? If people call and someone really needed the ICU bed, so what will be the arrangement made for those people?
Right now, if you say, as you have seen the BKC Jumbo Center, there are no ICU beds available. The same scenario is there since last 4 to 5 days with all hospitals. In K East, we have Seven Hills and Trauma Care Center, BMC facilities, plus private hospitals are there, also 6 hospitals. We check everyone, and if there is no availability, then we एटलीस्ट ऑक्सीजन बेड जो होता है वो उन्हें देने के लिए कहते हैं जंबो सेंटर दे एक्सेप्ट द पेशेंट ऑक्सीजन पे लगा के बाद में उन्हें आईसीयू पे जैसे ही वैकेंसी हो जाती है शिफ्ट किया जाता है
As you has already informed that the people has been segregated looking after the condition which people is going through. If they have a symptom, they will send to the ICU or the oxygen bed. But what if like people, how many beds for now is available in the case if someone calls and if they really need an oxygen bed? But as we can see, the BKC jumbo facility is not available. So where they will be shifted to?
we our team check each and every hospital of entire Mumbai because this dashboard is for entire Mumbai. We check each and every facility anywhere. If available, we put request and they immediately we get the response from them, then we send the patient. But if not available, then no option but to keep the patient waiting.
So as we can see, the COVID-19 cases in Mumbai are specifically arising, and it has been increasing day by day. But the BMC officials are trying very hard for every patient, every COVID patient with the symptoms. If patient really needs it, the oxygen bed or the ICU bed, they work continuously hard to get the patient to the specific hospital and be required with the bed. So this is, I was reporting from, it's a K East ward where they look after. Once I will show you the visuals, how the BMC officer, the BMC staff has been working day and night for the people, and they have already first segregate all the patients from all the hospitals and to the dedicated. This is not only about the K East ward where we are reporting from, but this is from the entire Mumbai. As we can see, all the patients, it's not only about the COVID-19 patient, but the fumigation of the society premises, the containment of the society premises is been looking after by the ward which is been dedicated to each and every areas in the Mumbai. In Mumbai with video journalist Kanti, this is Alisha Nair for Republic TV.